Namaste. Today's 5 questions and 5 points are extremely crucial in the interest of your own well-being, of your child's well-being, and of course, the family and society's being. The first question: I haven't ever checked my sugars, and on the first visit in pregnancy, the doctor seems to recognize that I have very, very high blood sugars. What should I do next? Well, the answer is that you take a sincere suggestion from your doctor, because if you've never ever been tested before and it's the first time, it all depends on the value of the sugars based on which the doctor will guide you. There may be a request for a fasting blood sugar, the post-meal blood sugar, and a special test called HbA1c. Depending on that, she will predict your chances of a healthy ongoing pregnancy. So that's step number one. The second question: what if all of these are somewhat in the normal range, just a little haywire? Should I then be quite confident of carrying through my pregnancy well? This second answer, I may only say that this is your start point of caution. Don't be complacent. Congratulations, because you've started your pregnancy well. So it's near normal. You should strive to keep it optimal. The doctor will tell you some target sugars, like, for example, your fasting sugar should never cross 90 mg%, or your post-meal should not cross 140 after an hour and 120 after 2 hours. All these have to be very, very strictly maintained with diet and exercise. If not, they may add either tablets or insulin. But it's crucial that you must strive to maintain a normal sugar level. So congratulations, you started well. You missed the bus a little bit because you didn't get tested before pregnancy, but it's okay because you're still doing well and you must continue to do well. Third question: what if the sugars are haywire and the doctor is not giving me any guarantee for a normal development of the baby? Well, the third point and the answer to the third question is the doctor is only telling you the truth, because the folic acid supplement, which is given pre-pregnancy, is to prevent what is called the neural tube defects. The picture that you see here depicts a defect in the spinal cord, and the incidence is normally any 20 babies out of 1,000 may have this if the folic acid is not taken. Compared to this, if you have not taken folic acid, if you've not controlled your sugars, and the sugars are haywire right at the start, the chance that your baby may have a neural tube defect is 20 times more than if you were having a normal sugar. That means not only this, there are several other malformations or abnormalities in the baby which go sky high. In the general population, if neural tube defects occurs only in 1 out of 1,000, here it may be 20 out of 1,000. So again, we are coming back to the emphasis that see that you enter the pregnancies with normal and controlled sugars. Point number 4. None of the defects have been found yet. So can I take it that all is well? Well, the fourth point is about continuum of care. Even if you've started well, even if the early pregnancy scan shows that all is well, by the 5th month or 6th month, when a detailed scan, especially the study of the child's heart, is done in detail, the doctor will be able to then opine that everything is as if in the general population, in your case too. So the caution throughout the pregnancy and paying attention to your diet and exercise pattern is really, really crucial. And as many times as the doctor requests, you will need to check your sugars and see to it that they're in the normal range. The 5th point, or the last point: what if these defects are detected? Well, it is very, very sad if the control has not been achieved, and in fact, the doctor figures out on the scan that there may be these defects or even genetic defects, then the advice may go towards termination of pregnancy if these are major malformations where the quality of life or the life itself cannot be dealt with. after the child is born. So it tilts the entire track of the decision making. But be wiser next time. See to it that you enter the pregnancy in the best of the circumstances. Wishing you well, wishing you all the caution that you can exercise, all the seriousness with which you will safeguard yourself and your pregnancy. This is Dr. Hema Divakar signing off from 5 questions, 5 points, 5 answers, 5 minutes program.